Healing gardens in urban hospitals represent a powerful intersection between modern medicine and ancient wisdom, an acknowledgement that recovery is not only a biological process, but also a psychological and emotional journey. In a time when urban healthcare centers are often dominated by sterile hallways, fluorescent lighting, and high-stress environments, the integration of live green spaces offers a profound shift, a return to the sensory balance that humans instinctively seek in times of illness and vulnerability. Far from being mere landscaping, these gardens are carefully designed therapeutic environments, and the evidence now strongly supports their impact on patient mood, recovery speed, and overall well-being. The concept is not new. Monastic infirmaries and early hospitals often featured courtyards or gardens, where patients were encouraged to sit under trees or walk along flower-lined paths. What has changed is the scientific rigor with which modern healthcare architects and researchers now approach the design and evaluation of these spaces. Today, hospitals in dense urban centers are increasingly carving out rooftop gardens, internal courtyards, and even vertical green walls, not for aesthetics alone, but to harness nature's healing potential as part of integrated care. Numerous studies have confirmed that exposure to live, natural settings in healthcare environments reduces stress, improves mood, and can accelerate physical recovery. One of the most cited pieces of research in this field, again by environmental psychologist Roger Ulrich, found that surgical patients whose rooms faced a natural view, trees and grass, recovered faster, used fewer painkillers, and had shorter hospital stays compared to those facing a brick wall. Since that seminal work, dozens of studies have explored how even brief contact with greenery, through window views, outdoor walks, or time spent in hospital gardens, can reduce anxiety, ease depression, and improve patient satisfaction. Live plants and gardens offer multisensory stimulation. The visual pattern of greenery, the scent of flowers or herbs, the gentle rustle of leaves in the breeze, the warmth of sunlight on skin, and even the tactile experience of touching a plant or sitting on a natural bench. These experiences activate the parasympathetic nervous system, helping the body shift out of stress mode and into a restorative state. In this state, heart rate lowers, blood pressure drops, and stress hormone levels decline, all of which support immune function, wound healing, and pain tolerance. For patients dealing with chronic illness, traumatic injury, or long-term hospitalization, green spaces also provide an essential psychological outlet. They offer an escape from the monotony and confinement of clinical rooms, a place where patients can reconnect with a sense of normalcy, agency, and hope. Simply walking through a garden, observing seasonal changes, or watching birds and pollinators can provide moments of joy and meaning, especially for those who are otherwise isolated. Healing gardens also play a vital role in supporting mental health within hospital populations. In psychiatric units, cancer treatment centers, and rehabilitation facilities, time spent in nature has been linked to reductions in agitation, depression, and emotional distress. Patients who participate in garden-based activities, such as light gardening, mindfulness exercises, or simply sitting in a quiet outdoor space, report greater feelings of peace, reduced anxiety, and even increased motivation for therapy or treatment adherence. Importantly, the benefits of healing gardens extend beyond patients. Families, caregivers, and hospital staff, often under enormous emotional and physical strain, also use these spaces to decompress. For nurses, physicians, and healthcare workers facing long hours and high burnout risk, even short breaks in a garden can restore emotional balance, reduce fatigue, and help maintain compassion and focus. This makes green spaces not just patient-centered, but systemically beneficial to the healthcare environment as a whole. Design matters. The most effective healing gardens are not just pretty, they are intentional. They provide accessible paths for patients with limited mobility, shaded seating, and calming focal points like water features or gentle sculpture. Some include elements from different cultural traditions, creating a sense of familiarity and inclusivity. Others are designed with specific populations in mind: sensory gardens for dementia patients, edible gardens for pediatric units, or meditative labyrinths for spiritual care. Even in cities where land is scarce, urban hospitals are finding innovative ways to incorporate greenery: rooftop terraces, green atriums, window planters, and modular gardens that fit into small courtyards or balconies. Advances in horticulture, irrigation, and landscape design have made it easier to maintain living plant systems indoors and in tight urban spaces. Some hospitals are also integrating biophilic design principles into their architecture. using natural materials, organic patterns, and daylight exposure to mimic the calming influence of nature even in indoor environments. As healthcare continues to evolve, healing gardens remind us of a timeless truth that recovery is not only about procedures and prescriptions, but also about how a person feels in their environment. The presence of life, light, and green can shift a patient's experience from one of isolation and illness to one of connection, comfort, and hope. These spaces help the body heal, but perhaps more importantly, they help the person inside the body feel like they are more than just a patient. In the heart of concrete cities, surrounded by machines and urgency, a small garden can offer something priceless: a moment of peace, a breath of fresh air, and a quiet reminder that healing is not only possible, it can be nurtured.